So this question is in relation to intracranial hemorrhages or brain bleeds. Do they get surgery? Sometimes. So this is different areas of the brain where you can have bleeds. You can have something over the brain in the layers that cover the brain, which is called an epidural bleed. You can also have a subdural bleed, which is underneath those areas. And then you can have an intracerebral hemorrhage, C, where you actually have blood in the parenchyma of the brain, or rather in the brain tissue. Depends on what kind of bleed you have. You actually can get surgery for it. For instance, for the first two, you can have drainage, where a neurosurgeon will go in and drain that blood and evacuate any kind of blood clot. For intracerebral hemorrhages, they might not be able to evacuate blood clots, but sometimes they can. But what's more common for intracerebral hemorrhages is if there's a lot of pressure that's putting pressure onto the brain, shifting it from one area to the other. You can actually do a procedure called a craniotomy, where you remove part of your skull to let the brain expand. That is shown over here. Now, recently there was a trial called the ENRICH trial, ENRICH, that showed that doing this early on can improve survival and overall outcome. So the long story short is, yes, you can have surgical treatments for these brain bleeds. However, they can still become scar tissue and create epilepsy either very early on or even later. I've seen patients who've had seizures within like the first few hours, within the first few days, but I've also seen patients who've been otherwise totally fine, and a year or two later they'll have seizures. Usually when you have seizures much later after the event, I'm talking 30 days after the event, if you've had your first seizure, that's more likely to become epilepsy than a patient who has a seizure right away after a brain bleed.